If you have a disc bulge or herniated disc causing leg pain, sciatica, or relentless lower back pain, you've probably wondered if an inversion table could help. Some people swear by it, others say it made things worse. But there's another option that's gaining traction, if you pardon the pun, and it's designed to target the root cause of disc pain without medication, injections, or surgery. In this video, I'll show you the real difference between inversion tables and spinal decompression and which one could actually help you heal faster and feel better for good. And later in this video, I'll show you the one mistake people make with inversion tables that could be making your disc problem worse. Hi, I'm Dr. John Zalonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada, and I'm the past director of rehabilitation at the Ottawa Sports Science Centre. Inversion tables have become one of the most talked about tools for back pain relief. You've probably seen them advertised as a simple at-home solution to decompress the spine and relieve pressure. And guess what? I just happen to have one in my home gym as well. Here's how they work. You strap yourself onto the table. You lean back by having your feet securely in here, down in the footrest, and then you're slowly going to invert yourself so that your body is either tilted, so you could be at any angle less than parallel to the ground, or you can become fully upside down. The idea is that gravity will gently pull your spine apart, creating space between the vertebrae. In theory, this reduces pressure on your discs and the nerves. Some people report temporary relief. It can feel good in the moment. You might even feel a little stretch in your lower back or legs. But here's the catch. Inversion tables apply a general stretch. They don't isolate specific spinal levels like L4, L5, or L5S1, which are the most common disc bulge or disc herniation sites. That means if you have a herniated disc pressing on a nerve, this method may not actually target where the problem is. And in some cases, using an inversion table the wrong way can actually make disc injuries worse, especially if you have a herniation and you don't know it. So how does spinal decompression therapy compare, and why do clinics use it instead of inversion tables? Spinal decompression therapy is a non-surgical treatment designed to relieve pressure on the spine, especially in cases of disc bulges, herniations, or nerve compression. Unlike inversion tables, spinal decompression is done using a specialized table or system in a clinical setting. It gently and precisely decompresses the spine, targeting specific levels like L4, L5, or L5S1. The goal is to create negative pressure inside the disc. This allows herniated or bulging material to retract back towards the center of the disc and reduces pressure on the nearby nerves. The treatment is typically guided by a chiropractor or other type of doctor or therapist, which means it's personalized. They can adjust the angle, the amount of pull, the duration, and the rest periods between the cycles. This is what we call the technical factors. That level of control is something an inversion table simply can't offer. For someone dealing with disc-related leg pain or sciatica, spinal decompression can be a game changer. It's not just about relief, it's about creating the right conditions for the disc to actually heal over time. And here's something most people don't realize. Spinal decompression is often used to help patients avoid surgery altogether. In fact, many people turn to it when injections and drugs have failed. Now that you understand how each one works, let's look at which option actually delivers better results with people with disc bulges and chronic leg pain, not just to feel better, but to stay better. Inversion tables might provide short-term relief because they stretch the spine in a general way. But the key word is general. They don't target the specific disc that's bulging or herniated, and that's the problem. When you have a disc pressing on a nerve, like in cases of sciatica or radiating leg pain, you need precision. Spinal decompression, on the other hand, is designed to be specific. It targets the problem area directly. Studies have shown that spinal decompression can reduce disc pressure, improve circulation in the area, and support the body's natural healing process. It's not just about masking the pain, it's about fixing the root cause. Most importantly, spinal decompression creates negative pressure inside the disc, something inversion or traction will never do. If you've been told surgery is the only option, pay attention. Many patients who are facing surgery have avoided it completely with spinal decompression. But effectiveness is only one part of the story. What about safety? That's where the differences between these two treatments really show up. Let's talk about that next. When it comes to treating a disc bulge or herniation, safety should always come first. And that is where many people run into trouble with inversion tables. Inversion tables can raise your blood pressure, they can increase pressure in your eyes, they can put extra strain on your heart. If you have glaucoma, high blood pressure, cardiovascular issues, or even vertigo, inversion therapy can actually be dangerous. There's also the risk of aggravating your disc problem if you tilt too far back, if you do too fast, or if you stay inverted for too long. Spinal decompression therapy By contrast, is done under supervision. It's controlled, it's gradual, and it's tailored to your body and your spine. The system only pulls within safe limits, and it can adjust based on how your body responds. This makes it much safer for people with disc herniations or severe nerve pain. This is where many people make their biggest mistake. They try an inversion table thinking it's a safer, cheaper alternative, only to find their symptoms get worse. Sometimes a few minutes of the wrong approach can set your recovery back weeks. Now let's answer one of the most common questions patients ask me. Can you use an inversion table at home safely, and what should you know before trying it? The appeal of inversion tables is simple. You can buy one, set it up at home, and use it whenever you want. But just because something is accessible doesn't mean it's effective or safe for disc injuries. If you're dealing with a disc bulge or herniation, hanging upside down at home might not be the right call. Inversion tables aren't personalized, they don't adapt to your specific spinal level or condition, and without professional guidance, you're relying on trial and error with something that involves your spine and nervous system. Even if you follow the instructions, many people overdo it. They stay inverted too long, they use it too frequently, or they don't stop when their symptoms flare up. I've actually seen people fall off a table. I've actually seen people who can't get back up again after going inverted. This can lead to more inflammation, more nerve irritation, and more frustration. Spinal decompression, on the other hand, is not a DIY. It's not a do-it-yourself. It's a structured, guided treatment plan from a professional that progresses based on your response. You're not guessing, you're following a plan. And here's the part no one talks about. If you use an inversion table the wrong way too early in your recovery, it can actually delay healing and make decompression less effective down the road if you switch later on. Let's make this simple. I'll break down the key differences between inversion tables and spinal decompression side by side so you can see which one actually fits your needs. So let's do a side-by-side comparison so you can see exactly how inversion tables and spinal decompression differ. So for an inversion table, it's going to provide a full spine stretch using gravity. There's no ability to target specific discs. It can be risky for people with high blood pressure or glaucoma. Often it will provide short-term relief, but it doesn't fix the actual root cause of the problem. It's used at home, often without any guidance. So then, of course, why do I have one? I have one because I understand the difference between the two. Obviously, there's a difference. An inversion table is going to cost you about $500. My robotic laser spinal decompression system is into the six figures. Inversion tables are best when you're looking to maintain wellness. If your spine is in decent shape and you want to keep it that way, then yes, relieving the effects of gravity can be beneficial. It is not what you want to go to when you have a serious issue. Spinal decompression offers precision targeting of spinal segments like L4, L5, or L5S1. It's supervised by trained professionals. It's a controlled pull with adjustable force and timing. It's designed to promote disc healing and nerve recovery. It's research-backed to help avoid surgery in the first place. When you compare them side by side, the difference is clear. One stretches your spine, the other helps it heal with true decompression. If you're serious about long-term relief and you want to avoid surgery, this decision could shape your recovery more than anything else you do. Now let's take everything you've learned and apply it in the next section. I'll help you decide which option is right for you based on your symptoms and your goals. If you're dealing with general back stiffness or occasional muscle tightness, an inversion table might give you some temporary relief. But if you have a diagnosed disc bulge or herniation, especially like sciatica or leg pain, that changes everything. For disc injuries, the priority is to reduce nerve pressure in a controlled and safe way. That's exactly what spinal decompression is built for. It's not about flipping upside down and hoping for the best. It's about creating the right conditions for the disc to heal while keeping your spine supported and your nerves protected. Many people turn to decompression after trying everything else, drugs, injections, even failed physical therapy, but it doesn't need to be a last resort. It can be your first step toward real long-term healing. If you've been stuck in a cycle of pain, doing all the right things but not getting results, it might be because you're using the wrong tool for the job. Decompression could be the result and the reset that your spine actually needs. Now you know the difference. Inversion tables might offer a general stretch, but for real healing, especially with disc bulges, herniations, and radiating leg pain, targeted spinal decompression is a smarter, safer, and more effective path by far. If you've been living in pain, unsure where to turn or who to trust, I hope this gave you clarity and confidence. You deserve answers, and more importantly, you deserve results. Relief is possible, healing is possible, and you don't have to face surgery to get there. At our clinic in Ottawa, Ontario, we've helped thousands of patients recover from disc herniations, bulging discs, sciatica, and spinal stenosis using a powerful next generation treatment called non-surgical robotic laser spinal decompression. It combines precision technology and laser therapy to accelerate healing and decompress the spine in ways traditional symptoms can't. To see exactly how non-surgical robotic laser spinal decompression works and why so many of our patients are finally getting lasting relief, go watch this video next. It breaks down what makes this treatment different, how it helps with disc bulges, herniations, sciatica, and stenosis, and why it could be the turning point in your recovery. Please go watch this video next.